Hi, I'm Dr. John DeSantis. I'm an orthopedic surgeon at Desert Orthopedic Center, and today we're going to talk about total hip replacements. Candidate for hip replacement has pain in their hip. Usually when they feel pain in their hip, it is pain mostly centered in their groin. Patients complain that the pain is worse with activity, although at times it bothers them at night as well. The typical hip replacement patient comes into the office complaining of hip pain. We take an x-ray. It's usually a standing x-ray so we can see if the hip is bone to bone on x-ray. And then we talk about if they've had any non-operative treatment. Once we determine that patient is a candidate for hip replacement, we'll go over what a hip replacement is. So here's a model of a hip replacement I'd like to show you. This represents part of the pelvis. This represents the femur or the thigh bone. And these are model parts of a hip replacement. So a hip replacement consists of a cup that goes into the socket or the acetabulum. And then there's a stem that goes into the femur. And we have a metal liner, plastic insert that goes in that. And then there's typically a metal or a metal and ceramic head, and then patient is able to walk, and instead of them hitting bone to bone, they are now protected from hitting bone to bone by the new hip, which is going from ceramic or metal to the polyethylene. I think hip replacements are one of the most rewarding things patients can have. It's quite amazing that we can get this done in around an hour, and then it can change someone's life.